As adults age, protein becomes one of the most important nutrients for maintaining health, functional independence, and quality of life. While all older adults benefit from adequate protein, emerging research suggests that there are meaningful differences in protein requirements and utilization between men and women over 50. These differences are shaped by variations in muscle mass, hormonal changes, metabolism, and even lifestyle patterns. Understanding these nuances allows both men and women to tailor protein intake to maximize muscle preservation, bone health, immune function, and overall vitality, supporting healthy aging in a proactive and effective way. One of the primary factors influencing gender-specific protein needs is the difference in muscle mass. On average, men have higher lean body mass compared with women, which naturally increases their baseline protein requirements. Muscle tissue is metabolically active, and men's greater muscle mass means their bodies require more amino acids to maintain tissue integrity, support metabolic processes, and prevent sarcopenia, the age-related loss of muscle. Women, while generally having less muscle mass, are not exempt from the risk of muscle loss, particularly after menopause when estrogen levels decline. Estrogen has a protective effect on muscle and bone, and its reduction can accelerate the loss of lean mass, making protein intake increasingly critical for women to preserve strength, functional independence, and metabolic health. Hormonal changes play a central role in shaping protein needs for both genders. In men, testosterone gradually declines with age, contributing to reduced muscle protein synthesis, decreased strength, and changes in body composition. Higher protein intake, especially in combination with resistance training, can help mitigate these effects by providing sufficient amino acids to stimulate muscle repair and growth despite lower hormone levels. For women, the postmenopausal drop in estrogen increases the risk of both muscle and bone loss. Protein is essential for supporting collagen synthesis, maintaining bone density, and preserving muscle mass, helping women offset the accelerated decline that can occur during the years following menopause. Metabolic rate differences between men and women also influence protein requirements. Men tend to have higher resting energy expenditure due to greater lean body mass, which increases overall protein turnover. Women generally have lower basal metabolic rates, but age-related declines in lean mass can slow metabolism for both genders. Adequate protein intake helps counteract these effects by preserving muscle, supporting energy expenditure, and preventing excessive fat accumulation. By maintaining metabolic efficiency, both men and women can support healthier body composition, stable blood sugar, and reduced risk of chronic diseases such as type 2 diabetes and cardiovascular conditions. Exercise patterns further influence protein needs in aging men and women. Resistance training, weight-bearing exercises, and endurance activities increase amino acid requirements for tissue repair and adaptation. Studies suggest that both genders benefit from protein intakes higher than the standard recommended minimum of 0.8 grams per kilogram of body weight, with many experts recommending 1.0 to 1.3 grams per kilogram for optimal aging outcomes. Men with larger muscle mass may lean toward the higher end of this range, particularly if engaging in regular strength training, while women may find that achieving the same benefits requires careful attention to both protein quantity and timing, especially around exercise sessions. Even distribution of protein across meals has been shown to maximize muscle protein synthesis in both genders, but women may particularly benefit from focusing on protein at breakfast and lunch, as appetite is often lower earlier in the day. The type and quality of protein also matter for older men and women. Animal-based proteins, such as eggs, lean meats, fish, and dairy, provide complete amino acid profiles and are especially effective for stimulating muscle protein synthesis. Plant-based proteins, when properly combined, can provide all essential amino acids while offering additional benefits such as fiber, antioxidants, and anti-inflammatory compounds. Women who are at higher risk for osteoporosis may particularly benefit from combining protein-rich plant foods with calcium and vitamin D-containing foods to support bone health. Men, whose larger muscle mass places higher overall demands on amino acids, may benefit from a combination of both animal and plant proteins to ensure sufficient intake while also gaining cardiovascular and metabolic benefits. Protein also interacts positively with other nutrients and lifestyle factors in gender-specific ways. For instance, older women may benefit from pairing protein with resistance training to counteract postmenopausal muscle loss, while older men may emphasize protein timing around exercise to preserve both strength and lean mass. Protein combined with adequate calcium, vitamin D, magnesium, and omega-3 fatty acids supports bone integrity, reduces inflammation, and enhances recovery from injury or illness for both genders. Attention to meal composition and nutrient synergy allows older adults to gain maximum benefit from protein intake, improving functional capacity and long-term health outcomes. Beyond the physiological effects, adequate protein supports broader aspects of well-being for both men and women. It helps preserve mobility, balance, and strength, reducing the risk of falls and fractures. It supports immune function, aiding recovery from illness, surgery, or minor injuries. Protein also promotes satiety and stable energy levels, helping manage body composition and supporting metabolic health. When tailored to the unique needs of men and women, protein becomes not just a nutrient, but a tool for maintaining independence, vitality, and quality of life in later years. In practical terms, both men and women over 50 can benefit from consciously incorporating high-quality protein into each meal and snack. Breakfast might include eggs with vegetables or a protein-fortified smoothie. Lunch could feature grilled fish or a lentil salad. Snacks might include Greek yogurt, cottage cheese, or nuts. And dinner could include lean meat, tofu, or legumes with vegetables and whole grains. Distributing protein evenly across meals and choosing nutrient-dense, high-quality sources helps both genders meet their specific protein needs, supports recovery from exercise, and promotes optimal functional health. Ultimately, while both men and women require adequate protein to support healthy aging, subtle differences in muscle mass, hormonal changes, and metabolic rate suggest that protein needs may differ slightly between genders. Men often require higher total protein to maintain larger lean body mass, whereas women benefit from targeted protein strategies to counteract postmenopausal muscle and bone loss. Recognizing and responding to these differences allows older adults to personalize their diets in a way that maximizes muscle preservation, supports bone and metabolic health, enhances recovery, and maintains functional independence. By prioritizing protein strategically, both men and women can embrace aging as a stage of strength, resilience, and vitality, transforming nutrition into a powerful tool for thriving well into later life.